Hi, everybody. This is Susan Clinton, and this is our webinar part three, which is we've been doing the three-part webinars on light therapy. We had Light Therapy 101 with Liz, and then we've had the wonderful research behind red light therapy with Dr. Genevieve. We're back with Liz again, and she's going to talk all things pelvic health with us. So, Liz from Fringe Heels takes it away.
Thanks, Susan. So I'm back and welcome everybody for part three. This is where we can take a bit of a deeper dive into where red light really is effective and helpful for pelvic health. We'll discuss the mechanism of action of light therapy in a bit of a review fashion, as well as the pelvic conditions related to those mechanisms of action. And I will note that they do all intermix and overlap. So it is not as though one condition only uses this one mechanism of action. But I've tried to put the conditions into different areas where maybe one mechanism of action might be more beneficial than the next. Just realize that they do all overlap. Let's start with a little bit of a review on light therapy and its application and what it does. So the application of light, all wavelengths from the sun to humans can be beneficial. When we look at red light, near infrared light, and blue light, those are the wavelengths of light that we've captured in different therapeutic devices that are, I'll say, the most important and the most researched for benefits to the human body. They are considered bioactive. That's the term that we've used. So the benefits of light therapy that I went over in our first webinar series was that light therapy can increase energy or ATP production at a cellular level, can increase elastin and collagen production, the building blocks sort of our cell, increase blood flow, which brings oxygen and nutrients to our tissues, and it can also help reduce inflammation and pain. Lastly, the blue light will help reduce fungal and bacterial infection. So these are our five, let's say, mechanisms of action. Now we're going to dive into a little bit of what they're doing and what conditions they're most related to. Before we touch on that, though, I wanted to touch on vibration therapy because the pelvic wand also has vibration therapy built into it. The application of vibration to the human body can induce a positive physiological response. This is really well researched with external uses of vibration as well as internal, but external uses of vibration therapy for rehab purposes. So if vibration is applied at low levels, like low hertz, that's how it's measured, to the body, that can be very soothing and relaxing to the tissues. Whereas if vibration at higher levels is applied, it can actually kind of stimulate, wake up, facilitate the muscles. So that's important because the wand does have four different levels of vibration, some low and then some a little bit higher. So it can also be stacked and used along with the red and near infrared light therapy in the wand to help further pelvic health conditions. The way the vibration is effective is that it can help tissue rejuvenation. It can help stimulate collagen and elastin fibers within the muscles. It can increase blood flow because we're actually vibrating our cells and our tissues, and blood flow increases oxygen and nutrients to the surrounding tissues. As well as I said, the vibration can be either relaxing or stimulating. And that's where we look at the gate control theory of trying to stimulate muscles for either relaxation or contraction. So let's look at the first benefit or the first mechanism of action of the light therapy. I'll just turn my wand on for those that are watching so they can see again how the wand does emit red and near infrared light therapy. The first mechanism of action is an increase in energy production or ATP production, and that's at the level of the mitochondria of the cells. So at the level of the mitochondria, there's cytochrome C and water. These are both chromophores. Chromophores are cells or constituents of the cell that absorb light. And at that point, there's a whole cascade of reactions that are occurring at the mitochondrial level. One of the byproducts is ATP or energy. So you can see here we're contrasting, say, an unhealthy mitochondria with a healthy mitochondria, and the healthier mitochondria receiving light is making more energy for the cell. The second mechanism of action is an increase in elastin and collagen production. So as we age, we have reduced levels of estrogen circulating in our system, and that leads to tissue atrophy essentially. So this is really common to have it experienced in the whole pelvis. What we want to do is to stimulate elastin and collagen production in the pelvis to help reduce atrophy and weakness. So the light therapy can be very powerful, as I mentioned, to increase energy production and increase our connective tissue, that's elastin and collagen production. It can also help modulate reactive oxygen species. I'll discuss this after, but it's leading to more of a tissue, let's say, rejuvenation versus breakdown when we look at that continuum, and also increased blood flow, which I'll discuss in a second. I just didn't want to leave them out because they are part of the next two conditions that we'll look at. Two symptoms that women can experience that are associated with atrophy and weakness are prolapse and stress urinary incontinence. So I'll discuss both of them one after the next here and look at how we would use our light therapy wand to help with these conditions. So prolapse is essentially when our organs in the pelvis, for example, descend into that vaginal canal and even can come beyond the vaginal canal. Women will experience symptoms of heaviness in the pelvis. That's what's often sort of described, especially as the day goes on. So if you've been on your feet for long periods of time, or you're carrying heavy loads, even carrying, say, a new infant when the pelvic floor has maybe gone through trauma, people will have a sense of heaviness. People can say, hey, you know what? I actually kind of feel like something's falling out. They actually have a sense of that. They can feel something just not right down there. Other women will report having difficulty with a bowel movement. They'll actually have to press on their perineal area prior to having a bowel movement to help the feces sort of slide out or come out. Or people will discuss having difficulty with intercourse where they feel like something's kind of in the way. So these are common symptoms that I'll hear from my clients that make me think, maybe they have some prolapse, right? So if you're feeling like you might have these symptoms, then this might be you, and light therapy could be helpful. The next one that we're going to look at is incontinence. So stress urinary incontinence is essentially when you have trouble holding in or holding back the flow of urine, usually because of some sort of weakness or atrophy in the pelvic floor. So if you find that you're having a little bit of leakage when you cough or sneeze or laugh or jump or run, especially when you have to do some sort of a quick abrupt movement, that kind of a thing, then you may be suffering from stress urinary incontinence. There's tons of reasons why someone might have, say, prolapse or stress urinary incontinence. However, a weakness is often a part of this. That's almost universally common to having either of these conditions. Both of these conditions, the prolapse or the stress urinary incontinence, I find in my practice are very common in my postpartum mamas where their pelvis has gone through birth or trauma, and or in my menopausal women where there may have been atrophy over a longer period of time, and then something occurs like picking up your grandchildren or lifting rocks in the garden, something like a stress to the pelvic floor that then has someone come into the clinic saying, I feel heaviness, or I've had more leakage more recently. So we explore whether or not that the weakness and atrophy might be associated with this condition or these conditions. How would we look at using light therapy and vibration therapy to help combat atrophy? What we would do is we would use the pelvic wand, and I will note, you can use it externally before using it internally, or even just externally. I've had a lot of questions about that, so I wanted to make sure that that's clear. What I would recommend is red and near infrared light therapy versus just the red light. So there's three modes as we've discussed, but this is the red and near infrared, blue, and then just red. You would only use the just red light therapy if you are really sensitive to the heat that can be associated with the red and near infrared. I would use red and near infrared light therapy. I would use it for up to 10 minutes. You can start gradually, but I would build up to 10 minutes. That's considered a dose. And I would use it 3 to 5 times a week, up to 7 times, but 3 to 5 times seems to be the sweet spot for both adherence to using the red light therapy wand as well as optimal benefits. the vibration mode. With atrophy, we would be looking to use a higher level of vibration. Again, there's 4 levels of vibration. The top 2 levels of vibration that are in the wand would be the ones that I would recommend because that can help stimulate the pelvic floor muscles. So often the brain loses this connection with the muscles. They become dysfunctional, disconnected. And when you have vibration, like that cueing to the muscles, the brain kind of wakes up and says, oh, those muscles. And that's where we have this gentle stimulus combined with doing pelvic floor strengthening exercises, combined with the benefits of red light therapy for the energy production, the elastin collagen production. And I will also discuss blood flow next, but blood flow is also going to be important for atrophy and building up the strength of the pelvic floor muscles. And that will be very helpful for combating both prolapse and stress urinary incontinence. That's how I would use the wand for those conditions. When we look at the research, I'll just very briefly mention some of the research in these areas. But light therapy can be very supportive in this article showed it, in production of collagen and elastin, blood flow, which also increases lubrication, which I'll discuss following, and maintaining basically a very healthy vaginal epithelium. This was a great study that looked at all of the GSM, genitourinary syndrome of menopause, the causes, and how light can be very beneficial for it. When we look at atrophy in particular, this was a fantastic study. It looked at using LED light, which is the light that is in our wand, on vaginal atrophy, and patients underwent 6 weeks of treatment using blue, red, and near infrared light, so the same wavelengths of light that are in the wand, with 2 sessions per week, followed by a 1-month follow-up. And the study did report improvements in vaginal tissue health and reduction of atrophic symptoms. So like kind of fantastic studies to support what I've just mentioned when we're looking at prolapse, vaginal atrophy, stress urinary incontinence. So blood flow, I've already kind of sprinkled this in and mixed it in, but as we age and we have less estrogen circulating, we will have reduced blood flow, particularly to our pelvic tissues. What we'd like to do is use red light and near infrared light therapy to help combat this reduced blood flow. So light therapy works in 2 mechanisms of action. One is that at the mitochondrial level, with this whole cascade of reactions that are occurring, red light, one of the byproducts of this cascade from the red light therapy is that there's an increase in nitric oxide. Nitric oxide is a fantastic vasodilator. So in the tissues that are receiving the red light, you will have nitric oxide production, which will increase blood flow to the area. So that's one mechanism of action. And the second one to increase blood flow is that there's actually an increase in angiogenesis, which is the synthesis of new blood vessels. So not only are we increasing the blood flow to the area, we're also increasing the amount of actual, like say, capillaries and networks going to the area to deliver blood flow to the area. This is super important when we look at vaginal dryness. Vaginal dryness affects many women, particularly menopausal women, as well as breastfeeding, postpartum women. This is where we'll have a reduction in estrogen, which leads essentially to reduced blood flow and vaginal dryness. Symptoms that women will report or come into my practice mentioning is that they have a sense of like irritation, itching, burning, discomfort with penetration because things are so dry. Some people will even have an irritation with prolonged sitting, and this will often come up where they say, like on long car rides, they just feel very uncomfortable. And it can be even so severe that people will have discomfort just wearing underwear. Even the friction of a cotton underwear can be irritating for women. This is something that a lot of women experience. And if we can increase the blood flow by way of light therapy, that would be a huge game changer. When we look at how I would dose using the light therapy wand or any other light therapy product, is that I would recommend using red and near infrared light. Again, same as previous, unless of course you're sensitive to the gentle warmth associated with the near infrared, then just use the red light therapy. I would dose it very similar to with tissue atrophy and with prolapse or weakness or any of those conditions, where I'd be recommending using it 3 to 5 times a week for up to 10 minutes. Again, you can start gradually, you can start slowly, but I would try to increase to 10 minutes to have the optimal dosage to the tissues. I would also pair this with low to moderate frequency vibration, again, to stimulate the cells, to stimulate the tissues, to increase blood flow. So, stacking our therapies of light therapy as well as vibration therapy. If you're going to be intimate, I always recommend using the wand prior to intimacy. So, if you know you're going to be intimate, I don't know, on today's Wednesday evening, then maybe save doing your light therapy session to prior to intercourse, because then we're getting a little bit of gentle warmth and heat, we're getting vibration, stimulating the tissues and increasing blood flow, essentially at the time where we're really wanting it most. So that would be for short-term effects. Long-term effects, you would want to be using it regularly, 3 to 5 times a week. Okay, so that's looking at dryness. Another area where we're really looking to increase blood flow is with vaginal wounds. So this could be postpartum, this could be post-surgery, etc. So what we want to do is we want to increase mitochondrial activity, increase blood flow, and increase the collagen and elastin synthesis at the tissue level to help heal wounds faster. Symptoms that women will often complain about or note when they come into my practice postpartum is that they can have pain with tissue touch, like the tissues can be extremely sensitive and painful, pain with urination or wiping, certainly pain with intercourse, and there can often be a little bit of pelvic tension associated with any postpartum, say, wounds or post-surgical wounds, because there's a little bit of scar tissue that's developed where you've had the wound. So we would recommend using light therapy, and I would recommend using, similar to what I've already mentioned, the red and near infrared light therapy 3 to 5 times a week for up to 10 minutes. Here's where you would want to just start slow and low and do what's comfortable. So the wand does have a mode, and I can show it to you here, where you're using 50% of the light. I should say 50% of the intensity of the light. Same amount of light, just 50% of the intensity. So here I'm toggling back between 100%, which I would recommend for most conditions. But when we're looking at really sensitive tissues and wound healing, starting with 50% of the light intensity might be the way to go, because the tissues can be very, very sensitive. So that's an option there. I would also recommend using low level vibration, because if you have tight, bound up, sort of scarred tissues, then low level vibration can feel very relaxing and soothing and comfortable while promoting blood flow on top of what the red and near infrared light therapy is already doing. So that's where I would integrate that in. When we look at pain and inflammation, a lot of pelvic conditions that we see in practice are related to inflammation. So pain is what people will experience, pain is what they will come in reporting, but there's often an inflammatory process or an inflammatory condition behind the pain that people are experiencing. So light therapy can be very helpful to reduce inflammation. Basically, what it does is it will, I'll say, teeter-totter with reactive oxygen species, which are kind of negative or bad, to initially surge the amount of reactive oxygen species, but then your body will combat and have a net reduction in this. So less inflammation, less pain overall, like the net reduction in it. So that's where we would want to use light therapy to help reduce pain. Conditions that would be associated with pain, painful intercourse or dyspareunia is one of them. With dyspareunia or painful intercourse, there's often a tension, a guarding of our muscles, of our pelvic floor, and this can be associated with other underlying conditions or sort of as a standalone. Some of the underlying conditions could be endometriosis or bowel or bladder inflammatory conditions. Those include like interstitial cystitis or bladder pain syndrome. Symptoms that women will report when they're experiencing pelvic pain or lower abdominal pain would be like essentially what you can see in this picture, someone kind of holding their lower abdominal area saying, wow, this doesn't feel comfortable, right? Symptoms can often resemble those of UTI, so pain with urination and trying to void essentially. Can have urgency and frequency with urination as well. And then pain with intercourse. That's the most common one that I'll hear from people that are coming in with inflammatory, painful conditions with the pelvis. So endometriosis, we'll just chat about that briefly, but that's where you'll have like tissues growing outside of the uterus. The surrounding tissues can become very irritated and you can develop scars and adhesions. What we would want to do with light therapy is we would want to use either the wand intravaginally, or as you can see in the picture here, a wrap even over the lower abdominal area. So I would recommend, similar to what I've already recommended for other conditions, using either the wrap for 20 minutes or the wand for 10 minutes or both. That seems to be our kind of, let's say, magic dosage where people are using both the wrap and the wand for conditions like endometriosis or dyspareunia or what have you. Do note, as I had mentioned previously, that you can use the wand externally if you're not in a situation where you feel comfortable using it internally. So you could use this along the vulvar area, the wand, and the wrap along the lower abdominal area. So 20 minutes for the wrap, 10 minutes for the wand. Then I always recommend adding the low level vibration setting if it feels comfortable for you, if you feel like it's relaxing. And you can integrate both of these modalities with diaphragmatic breathing exercises, even light stretching, and so on. So you would want to increase the blood flow and reduce pain to the tissues, and then do a little bit of gentle movement and breathing to stack and layer your therapies there. This was a neat study here, and it looked at 128 women with chronic pelvic pain. 9 treatments were provided for these individuals, and it compared with baseline. 64.5% of women showed improvements in overall pain with bowel movements, intercourse, exercise, urination, sitting, and vulvar pain. That's a pretty powerful study that it did look like it did take 128 women, which is quite a few women, and it showed a change in the numeric pain rating scale in many different areas, not just one. So that's encouraging research. This is another piece of research that looked at women with interstitial cystitis and bladder pain syndrome, and they used near-infrared laser light transvaginally, inside essentially, to improve symptoms after just 8 weeks. So that's huge. 8 weeks is not sort of a long time. 83 patients completed this actual study, and they were using the laser therapy approximately twice a week for 3 to 7 weeks. 73.5% reported a 1-point drop, and 63.9% reported a 2-point drop on the numeric pain rating scale. And over 50% of women reported an improvement in their urinary urgency. So again, some really good numbers when people are actually using light therapy transvaginally as directed. The last mechanism of action for light therapy looks at blue light therapy. And I'll show you our blue light mode. So when you originally turn our wand on, it's red and near infrared. And if you touch the top button, the mode button, it brings you to our second mode, which is blue light therapy. So blue light therapy can be very helpful when we're looking at infections with pathogenic microorganisms, including like bacteria, fungi, viruses, etc. Blue light therapy basically help combat or ward off negative bacteria, whereas the red light therapy, so if we toggle back to red light, helps with all of the, I'll say, positive effects, benefits for the vaginal microbiome. So if someone's suffering from bacterial vaginosis or candida, like yeast infections, what I recommend doing is using, get it back to the blue light here, there we go, blue light therapy for 5 to 10 minutes, optimally 10 minutes, but then following up with the red and near infrared light therapy for 5 to 10 minutes. So if you've only got 10 minutes to dedicate to using your wand and light therapy, I would say do a 5 and 5. But if you can, 20 minutes, then I would use the blue light therapy for 10, followed by the red light, so that you have all of the benefits of like antifungal, antimicrobial with the blue light, followed by all the benefits of red light, where we're looking at tissue rejuvenation and blood flow and a healthy microbiome. So that's where we would kind of be combating microbial conditions. I should have mentioned beforehand, the symptoms that people will often report is an itching, burning, pain, sometimes discharge, even a rash. So those would be cues that you have sort of microbial or bacterial infection. And I already went over what I would do. So there we are. Now I just wanted to, I'll say, close off or end by some general how to use transvaginal light. So not related to specific pelvic floor conditions, but more of a catch-all. So before each session, we recommend that you shower, you wash yourself as you would normally so that you're clean, and then wash the wand with soap and water. The wand is recommended to be used with a water-based lubricant. And the reason for that is that this is made with a medical grade silicone that is clear. And so there is a little bit of a tackiness to it. It's not as slippery as some silicone sort of surfaces like dilators, but we would not want any oil-based lubricant to interact with the silicone. So we always recommend using a water-based lubricant so it doesn't break down the silicone over time. We'd recommend that you get into a comfortable position. So nobody would want to feel rushed or uncomfortable when using the wand. So make sure that you've created an atmosphere or an environment where you feel relaxed and comfortable. We recommend turning on the light therapy prior to insertion and even turning on the vibration setting that you're looking for prior to insertion. And then with the wand directed sort of upwards, I'll say, because there's a slight curve to it. So it's kind of towards the belly button, if you will. You can slowly and comfortably insert the wand. And again, only insert to a comfortable depth. If you're not comfortable with insertion, use it externally and you'll still receive all of the benefits of light therapy to the whole vulvar area. So that's of benefit. The wavelength, intensity, time, frequency, I have kind of gone over this, but it is essentially the same no matter what your condition is. It's whether or not you want to use red and near infrared or you're using blue before red, etc. Otherwise, you'd be working up to a 10-minute session as comfortable for you and using it 3 to 5 times a week. The reason why we say 3 to 5 times is if you have a condition that you're sort of really suffering from and you're hoping to make change fairly quickly, I tend to use the recommendation to go, let's go 5 times a week. So if I have stress urinary incontinence, I think I have some prolapse, I'm feeling really weak, I want to really kind of throw everything in the kitchen sink at this. I'm going to be using the wand 5 times a week. Once I feel like, hey, I think I'm seeing some change here, I feel a little bit more in control, my symptoms have settled, then I can dial back and use the wand, say 3 times a week, even 2 times a week, more as a maintenance dosage, if you will. Contraindications. So contraindications, like who should not use the wand? If you are photosensitive, that could be that you're taking medications that increase your sensitivity to light, then you would proceed with caution. That's where I would definitely recommend people using the 50% light intensity to start, and maybe even starting with 5 minutes and really monitoring your symptoms, making sure that your tissues are absorbing the light and feeling okay, that they're not increasing or irritating or any of the above. Photosensitivity is a definite cautionary approach. Cancer, on the other hand, is a contraindication. If you have a pelvic cancer, we would not recommend using red light therapy because we wouldn't want to increase the energy and increase the blood flow to a cancerous tissue. However, if you have cancer somewhere else in your body, let's just say, I don't know, your thyroid or breast cancer or something like that, and you've had radiation and you feel secondary symptoms in your pelvis like dryness and atrophy and so on, then you could totally use light therapy, just not over the cancerous site, right? Pregnancy, that's another contraindication, and we truly just don't have enough research on it. There's no research showing that it's negative, but there's not enough research using light therapy with pregnant women for us to then suggest using it. So it's a contraindication at this point. And open wounds. We like to, while we want to increase circulation for wound healing, if you have an open wound, that's contraindicated. Wait until your staples or stitches or bandage or what have you is off before using light therapy. In conclusion, light therapy is safe, it's effective, minimally invasive. It's a fantastic at-home therapy that is truly accessible and we hope quite affordable for most women. So it's a great adjunct to the therapy that someone might already be receiving and doing. So thank you. If you'd like to ask any questions or any of the above, you can email us at hi@fringeheals.com. You can also send DMs or find us on Instagram at fringeheals.
Wonderful. Do you mind stopping the share of your screen?
Yeah.
Excellent. Thank you so much for this. We've covered so much about red light, near infrared light, and blue light over the last three webinars, and this was just a great example of how this can work directly into pelvic health. There's only one question that I have, because we've already asked and answered so many. With the pelvic one, the recommendation is 10 minutes versus when we're using the
Mhm.
wraps, the recommendation is 20 minutes. Is there a reason for that? I'm sure there is.
That's great. When we look at the number of light chips in the wand and the surface area that they're going to be covering, 10 minutes is considered like a therapeutic dose. So based on the amount of light that is being projected in the piece. Whereas when you look at the wrap, the light chips are like further spaced apart and we're covering a really broad area. So that's
Mhm.
where the dose is going to be 20 minutes because it's emitting less light over a larger area than the wand.
Got it. And I think that that's a good distinguishing factor. The other nice thing about that is because it is so densely packed into the pelvic wand, people don't have to spend as much time, so 10 minutes is a lot. People can find 10 minutes easier than they can find 20 sometimes. I kind of like that for people who are like, I'm just going to do this in the bathroom. I've got 10 minutes. This is the one private moment
Yeah,
I have before my shower. I can do this. The 10 minutes is a little bit easier dosed. And that makes a lot of sense though, because all the pelvis, it's in tight quarters there. And you're
yeah.
not really covering a broad area when you're down into the perineal and pelvic areas.
For sure. I
And
find
then,
that 10 minutes prior to bed. So when
mhm,
I'm laying in bed, and if I have to be honest, sometimes scrolling my phone, I waste time doing that. So for me, that's a great time to say, Liz, put the phone down. Let's focus on your breathing. Let's focus on getting ready and sort of prepping you for bedtime. Let's relax and sort of, yeah, get ready for bed. So I'm already horizontal. I'm comfortable. I've, as you said, showered. I'm in my PJs. And that's a great time to spend 10 minutes kind of focusing on me versus the
mhm.
alternative, which is scrolling, really, if I have to be honest. Yeah.
And the one picture I think that is so important to stand out is that people always ask, can I do more than one part of my body at the same time? And yes, of course, Fringe now has a full red light mat that you can lay on. There's red light panels, so you're getting multiple areas at once. So you could use the pelvic wand and the wrap as you show, on the lower belly, where they may be having bladder pain or lower GI symptoms or any of those things, or C-section postpartum, maybe dryness. You could attend to both places at one time, which makes it a
For
bit more
sure.
time manageable as well. And again, self-care, it feels good, it's nice and warm, nice, good things to do for yourself. So, any final takeaways? What are some of the most frequently asked questions when you are around people at conferences?
I would say one of the most frequent asked questions, which is why I tried to say it a couple times, sort of just in the recording, but it's good to repeat, is that while the wand is available and the intended purpose is for internal use, you can also use the wand externally, right, prior to using it internally. If someone is postpartum and they're thinking, there's no way I'm using a wand inside. No, 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 it's okay. You don't have to. You can use it externally and you will still receive a lot of the benefits of light therapy because the tissues absorb the light and then there's all this cascade of reactions. I think of it like a pinball machine, right?
Mhm.
Where the light is and the chromophores, all the tissues are doing their thing. And the near infrared light therapy does penetrate deeper than just red. So you're still going to get benefits, even just using it externally. So I think that's one of the number one questions because some people say, they don't want to insert something or maybe not yet. That's fine.
Mhm.
Use it externally and then as able or as you feel comfortable, sure, go internal because that's the intended use so that we really directly impact the tissues, but it's not 100% necessary. So I'd say that's one of the biggest questions that I get asked. Yeah, more frequent questions that I get asked. Another one is in terms of like the washing and the care of it. And so it is meant to be single person at home device. And you just wash it with soap and water, warm, soapy water. It is waterproof. So wash it with soap and water, let it dry, and then store it in a clean place. That's the sort of direction that we offer with it.
And if you're going to use a lubricant, a water-based lubricant, right?
Yeah, that
Hmm.
is another question that we do get asked because everybody has their preferred lubricant. I mentioned it in the webinar too, but water-based because we don't want any oils to interact with the silicone over time and sort of degrade it or have any ill effect on it. So yeah,
Right.
water-based lubricant. Yeah, thanks for pointing that out.
No problem. All right. Thank you. And as always, submit your questions. We'll get them over and get them answered for you. Liz, thank you so much to you and to all of the healthcare providers that are involved with Fringe for
Hmm.
giving us these amazing webinars and really helping this population of clinicians really understand how to use and interact with red light, near infrared, and blue light if you've got the pelvic wand available.
Thanks so much. Thanks for having me, Susan.
Thank you.